Good afternoon, everyone, and welcome to our virtual health talk. My name is Melissa, and on behalf of the UHN Patient Education and Engagement Program, I would like to thank you for attending today's session on combating misinformation during COVID-19. I would like to take a minute to thank our planning team. So first, the Patient Education and Engagement Program, the Patient Learning and Experience Center staff, the Patient Partners Program, and lastly, Education Technology and Media Services. Now, a few words about our online format today. This session is being recorded and will be available for viewing at the same YouTube link afterwards. Today, we'll have a presentation for approximately 35 minutes, followed by a question and answer period. To submit your questions, we invite you to go to the link on your screen. You can also scan the code using your smartphone's camera or QR code reader app. You can submit questions anytime during the presentation, but we'd like to ask you to please keep a few things in mind before you submit your question. One, you can choose to include your name or stay anonymous, but please note that others will be able to see your name if you do choose to include it. Please do not include any personal details about your health or condition in your question. Our health talks are for general health information only, and the speakers are not here to diagnose or provide treatment recommendations. We'll try our best to answer as many questions as we can during the question and answer period. And lastly, you can also vote for your favorite questions by clicking the thumbs up button beside the question, and this will help bring that question closer to the top and they'll more likely be answered. If you have any questions about the live stream during the session, you can email us at pfep@uhn.ca or leave a voicemail at 416-603-6290, and a member of our team will get back to you shortly. And lastly, just a quick note on the topic of technology, we realize anything can happen when it comes to the internet connection. So with that said, should my connection cut out at any point, don't worry, you'll be seeing one of my awesome colleagues step in to facilitate this session. So lastly, we would love to hear your feedback about this presentation. Your feedback will help us know what you found helpful and how we can improve our sessions moving forward. To provide your feedback, please go to the link on your screen and complete the survey at the end of the session, or you can scan the code using your smartphone's camera or QR code reader app, and it will take you to the survey. Now, moving on to our presenters. First, you'll hear from Mohit Arora, who is an entrepreneur and marketing and brand strategist with a background in the music industry turned social impact activist. Mohit is passionate about dismantling racial and ethnic inequities in healthcare. Having spent the majority of his childhood in a hospital due to a rare liver disease, he now uses his personal experience to help others battling serious illness. Next, you'll get to meet Dr. Alon Vaisman, who completed medical school, internal medicine, and an infectious diseases specialization at the University of Toronto. He completed a Master's of Advanced Training in Clinical Research at the University of California, San Francisco, and was hired by the University of Toronto as an assistant professor in the Division of Infectious Disease. He began working at UHN in 2018 as an infection control physician and has been involved in the hospital's COVID response since the beginning of the pandemic. And last but not least, we have Lisa Cunningham, who graduated with a Bachelor of Science in Psychology and Linguistics from the University of Toronto and from the Library Technician program at Mohawk College. Starting at UHN as a volunteer, she became a staff member in 2018. She has worked in the Patient and Family Experience Centers at 4 of the UHN hospitals. So we have a great group of speakers here. I'm excited for you to meet them all. And first, we'll turn it over to Mohit, who will be starting us off.
Awesome. Thank you so much, Melissa. So hi, everyone. My name is Mohit. First of all, I just want to say that I'm glad to be here speaking with you all today and to be in the great company with the other speakers. So yeah, a little bit about me. I came to become a patient here at UHN about 7-8 years ago when I moved from Montreal to Toronto. I was originally referred to UHN through the transplant program at Toronto General, as I'm a liver transplant recipient. I'm currently in my 27th year post-transplant. And so I was also being seen, I also began being seen at the time by the family health team at Toronto Western. So now I'm seen across multiple sites within UHN. Um, and I came to become a patient partner at the beginning of this year. It was a little bit before the COVID-19 pandemic spread across our planet. And I saw notices for the patient partner program in the hospitals, but also in the email newsletters. And as Melissa mentioned, I've been very interested in kind of using my own personal experience to help others best understand how to navigate their own healthcare journey. So I was curious about the program. And as someone who is, I mean, still relatively young, as I like to think, but also someone who, like I said, I spent my entire life as a patient with regular follow-ups. Because of that, I'm always interested in finding new ways that I can offer my voice as a way to advocate for patients. So I became a part of the patient partner program, and I've been participating in different initiatives across UHN ever since. So now, when it comes to the conversation of dealing with information and misinformation surrounding COVID-19, I'm sure for so many of you, like myself, I can say it can become such a headache to deal with it. There are so many options available, and everyone will have their own process. What I'm going to share with you is by no means the only correct approach. It's simply my own personal approach, which I hope to share in hopes that perhaps it can help clarify for anyone else. So, at the beginning of the pandemic, I was a little bit disappointed that I hadn't received any information from my own physician directly, considering the fact that I'm at a higher risk than most. The sheer volume of what was going on at the beginning was putting a lot of demand on healthcare providers and doctors. But I will admit that the lack of more directed information for high risk patients was a big reason of concern for myself. So this meant I had to look for information on my own. The first source of information that I found was directed to transplant patients. It came from NHS, which is the National Healthcare Program across the UK. So at the beginning of the government mandated lockdowns in the UK, the general thought was these lockdowns would last anywhere between 2 weeks to 2 months, similar to here in Canada and US and other places globally. However, the NHS guided transplant patients specifically to be prepared to work from home and isolate until the end of this year at the very minimum. And so, being a transplant recipient, I am immunocompromised. This means my immune system is not as strong when it comes to fighting infections. And that's why I lean a little bit more towards the cautious approach when dealing with anything that involves viral infections, including right now, flu season. Although this kind of directive was more aggressive than anything else I had seen until that point, because this was still the early days of COVID, it did help me get a better understanding of the complexity of the situation during the early stages of what we knew. And while this was a source from the UK, I knew their information was reliable because the content is based on scientific research, which is regularly reviewed by other care professionals. As we've seen all of this year, there's a ton of information and misinformation involving COVID-19. We're hearing things from the news, from the government, our own government and other governments, from Facebook, and if you're anything like me, like a lot of group chats on WhatsApp. It's basically coming in from every which way, and almost all of it is conflicting with each other. It also means we have to be a little bit more aware of what health information can and cannot be trusted. So my approach is typically to avoid most media outlets like the news, TV, and social media. It's unfortunate to say, but the reality is the majority of media these days has veered further away from journalism and fact-checked information towards sensationalism and clickbaiting. If you're not familiar, clickbaiting is when a source, an outlet writes a sensationalized or even misleading headline just to attract you to click their link. And oftentimes the information on the site is either misleading, incorrect, and sometimes not even relevant to the headline itself. This is something I'm very conscious of, and I'm not saying there aren't some great sources and guests on these media outlets, but I do tend to source the bulk of my information from sources that I know I can trust without feeling like there's some form of deeper political agenda or any other form of media manipulation. So if you do choose to get your information from these sources, it's important to check first whether the authors and speakers are credible. And I believe Lisa will describe some of those tips that you can use to check later on in this session. Another suggestion I would offer is call your doctor or call your healthcare provider and ask them directly. In my opinion, the relationship you have with your doctor is fundamental to the quality of your healthcare. Oftentimes, the best practices of managing ourselves during a situation like this will vary based on where we're located. And your healthcare team will have the latest information based on the trends that are relevant to the communities that we live in. So definitely speak with your doctor or a member of your family health team. Find out what their recommendations are. And on that note, I would also recommend checking the website for your local hospital and even consider signing up for their email newsletters. I hate receiving spam, so I typically don't sign up for email newsletters, but this is an exception. I do find it to be a great resource for local health information. And if we can just move to the next slide. So just quick summary, here are some of my quick tips for combating misinformation. Speak with your doctor. Avoid using the media and media personality doctors as your only source of information, and check that information. There's two great sources. There's Google Fact Checker and there's Snopes Medical. They're great resources to just kind of debunk any myths. And if we can move to the next slide, slide 8, I've added a small list of resources that I use. Hopefully here, there's something that you can use and find helpful. So there's the NHS, which I mentioned earlier, is the national healthcare provider across the UK. There's the WHO, the World Health Organization. One of my favorite sources that I found is the University of Toronto's COVID-19 information guide. And that link itself also has a ton of other hyperlinks to other resources and sites. And again, check hospital websites and newsletters for your local hospital as well to get local information on where the pandemic is in your area. And that's it. I'll pass it on back to Melissa or Elon.
Thank you so much, Mohit. Thank you so much for sharing your experience. I know a lot of people definitely probably find it relevant, the same sentiments and feelings you were experiencing as you were finding health information for your own well-being. So thank you so much for sharing that and for sharing such helpful and trusted resources as well. So now we'll move on to the rest of our presentation. Today we'll talk about some current topics and questions about COVID-19 in an interview with Dr. Vaisman. Then we'll have Lisa share with us the importance of having reliable COVID-19 information, what to look for when finding quality health information, as Mohit had mentioned, and some more resources at UHN and in the community that can help you learn more about COVID-19. So now let's hear from Dr. Vaisman. So we have put together some questions for him to answer related to current topics that have been circulating around COVID-19. And we have 5 themes for him to tackle with us today. So our first one is about the notion of an infodemic and misinformation. So we have 2 questions here for us to get started. So Alon, our first question for you is that many international organizations, including the World Health Organization and United Nations, stated that we're not only going through a pandemic, but also an infodemic. Could you describe a little bit about what that means, what an infodemic means?
Sure. So an infodemic, a term that was coined and used frequently by the WHO, refers to the fact that as the infectious pandemic begins to evolve throughout the world, coupled with that, there's a lot of information that comes out that's disseminated by reliable and unreliable sources. So it becomes challenging for people across the world to interpret their risk of acquiring the infection and also what happens when you do have the infection. So lots and lots of information comes out. It's expected this occurs because anything that's new is bound to lead to a lot of new scientific research, a lot of anecdotes, a lot of people's testimonies, people's reflections on the infection. But important things to try to distill that down to what's accurate and what's helpful. So this infodemic can refer to information that's accurate and helpful, and then information that's incorrect and potentially harmful.
Thank you so much. So I guess that latter point would describe what misinformation means. Is that right?
Yeah, so misinformation is basically information that's not accurate that is often disseminated intentionally or sometimes even unintentionally by people. And it spreads so quickly because, first of all, because something is novel and because of social media and other channels for communication across the world, it's very easy for a message to reach from one side of the world to another. And secondly, because people are genuinely concerned about the infection, people are worried. They're worried about getting the infection. They're worried about having going to the hospital or dying as a result of infection. So it's very easy to understand why pieces of information very easily spread around the world. It's spread around here in Canada as well. And coupled with that is the misinformation that goes with it, which again can be disseminated by people knowingly or unknowingly, trying to help each other out, trying to let each other know what's going on.
Definitely, and especially in the age of like social media, things spread even faster than ever before. So thank you so much for clarifying those terms. We now have a very short video that we'll be sharing with everybody just to describe a bit more about what an infodemic is and some quick tips of how you can protect yourself from an infodemic.
We're not just fighting an epidemic, we're fighting an infodemic. This famous quote from WHO Director General has been widely shared. So what is an infodemic? An infodemic is an excessive amount of information about a problem, making it difficult to identify a solution. During a health emergency, an infodemic can drown out reliable information and allow rumors to spread more easily, impeding an effective public health response. Why is it happening now? Information can spread faster than a virus. With rapid growth of digital communications and social media platforms, information spreads fast from online to our physical lives. And how does it affect us? Online information can negatively affect our psychology, daily lives, and behaviors, worsening the ongoing crisis at hand. Infodemics make it difficult to recognize accurate and reliable information that tells people what preventative actions they should take. Some even promote stigma, discrimination, or violence. Therefore, we all play an important role to share trustworthy information and reduce disinformation. Here are simple actions we can do to mitigate the infodemic. 1. Look for facts and evidence. Be critical when receiving information. Question the source for accuracy and evidence. Compare with other sources. 2. Choose carefully. Share, like, or forward only content from trusted sources. 3. Be cautious. Do not reshare, forward, or like false information you know is not true. 4. Be a good example. Correct or call out people in your social networks when they post something untrue. Refer them to verified content and expert organizations for further information. 5. Spend less time online. Only seek the latest information at specific times of the day, once or twice a day if needed. Exercise, listen to music, or read a book. This helps to maintain good physical and mental health. Together, let's combat disinformation and misinformation. Turn the infodemic into a positive information experience, one that promotes facts and science.
I hope you found that video to be helpful. One of the steps they mentioned is the importance of learning the facts. So now we're going to go through some more questions about COVID-19 focused on the science and facts, and we'll have Dr. Vaisman clarify some of the misconceptions or some of the hot topics that are currently circulating. So our next theme is on prevention and transmission. So Dr. Vaisman, how does COVID-19 spread, and what is the difference between airborne and droplet spread? As we know, there are some confusion around the two terms.
So the primary mode that COVID-19 transmits is through large droplets. What that means is that when we cough or sneeze or even speak or breathe, we generate these droplets coming out of our nose and mouth. And so the virus can survive in these large droplets, and it generally can survive within approximately 6 feet, sometimes a little bit shorter, sometimes a little bit longer, depending on the environment. And if a person who is in near contact with that individual comes in contact to either their nose or mouth, they can acquire the infection as well. Another mode of transmission is also through what we call fomites or inanimate objects. So if you touch a contaminated surface and you bring your hand to your mouth or nose, you could potentially be infected that way. But the primary mode of transmission is through those large droplets. There are smaller droplets that can be generated when we cough or sneeze or speak or talk, speak or breathe. These are very small, and generally speaking, COVID does not transmit as well through these smaller droplets, or what we call aerosols, as well as it does through the larger ones. The implication for that is that if you're in a room that is well ventilated and you are well spaced from another individual and wearing a mask, you are very unlikely to acquire the infection. Whereas that's not true for other infections that are primarily spread through the airborne route, where you need to wear and use special precautions to prevent transmission.
Thank you. So I guess that goes to our next question too. If you could explain a bit more about why it's important to wear masks and how does masking help reduce that spread of those larger droplets?
So because the droplet transmission is the primary mode of transmission of COVID-19, wearing a mask provides very good protection against that. It's not 100%, but it provides a very high level of protection because the filtration capacity of most masks, for example, the medical masks that we wear, is very high. So the likelihood of the COVID droplets being able to transmit to you through the mask is very low. The mask has to be worn properly, of course. It has to be worn frequently and whenever in close contact with other individuals. And also it should be discarded if it's moist, if it's damaged, or if it's very hard to breathe through. And so this is found, based on preliminary science, is found to be one of the most important things we can do on a societal level and on an infection control level within hospitals to prevent transmission between patients and healthcare workers and amongst healthcare workers.
For sure, thank you. And I'm really glad you also emphasized the part that not only wearing the mask properly, but knowing how to put it on and take it off properly is also very key. So thank you so much for clarifying that. And I guess that kind of ties in with our next question because we're hearing a lot more about the idea of herd immunity around prevention and transmission of COVID. So could you tell us what is herd immunity? And another question we have is it beneficial for more people to get COVID-19 so that we can reach herd immunity without a vaccine?
So herd immunity refers to the fact that as a greater proportion of people in a population become immune to an infection, it is less likely to spread amongst those individuals. So there is a very high herd immunity for many infections. For example, when vaccination against measles was very high, we had a herd immunity, so that the few people in our society that can't get vaccinated against measles because of their weak immune systems or because they are on medications that suppress their immune systems, they are unlikely to acquire the infection because so many other people are immune. With COVID-19, because it's a completely novel virus, there is no herd immunity to begin with. As more and more people become infected, herd immunity begins to develop. However, the number of people it would take to get infected and acquire a level of herd immunity that would be strongly protective for those vulnerable individuals is extremely high. We're talking about perhaps somewhere upwards of 60, 70, 80%. In order to reach that, you would have to infect millions upon millions of people, which most people would consider to be unethical. So the aim of all the lockdowns and all the transmission and prevention events that we're doing across society is with the intention of minimizing infection, not increasing infection. So most people in the scientific world would not, or epidemiologists, scientists, physicians would not consider this to be an ethical way to try to reduce morbidity. Of course, when a vaccine hopefully is available, that will hopefully be the safest way for us to achieve herd immunity.
For sure. And hopefully that'll be sometime soon. Thank you. And so moving on to our next theme, it's around treatment. So we've been hearing more and more questions about what are the latest treatments available for COVID-19?
So the two medications that currently have the most evidence for their efficacy in treating COVID-19, firstly is a medication called dexamethasone, and it's a steroid. Steroids have long been used for medicinal purposes for many years for a variety of medical conditions, including some infectious diseases. The steroid is generally given to patients who are hospitalized and require supplemental oxygen to help them breathe. And the way steroids work, generally speaking, and in this context, is to reduce the inflammation in the lungs. In other words, to make it a little bit easier for the lungs to open up and for patients to breathe. A second medication, which was previously developed for other indications, was repurposed and now found to have some effect for patients who have COVID as well. And that medication is called remdesivir and is not as easily available in Canada as it is in other places in the world. And the indications for use of that medication are also narrower. So outside of those medications, there aren't any others that have yet to be proven definitively to provide benefit for patients with COVID-19.
Thank you so much. And you had mentioned, so those medications are for people who are hospitalized. So those with mild symptoms, are there treatments that are available for them?
That's a great question. So for people who do not require hospitalization, there is no currently evidence-based therapies for people with COVID-19. The treatment is what we call supportive. In other words, if you're having a headache, you take Tylenol. If you're having a fever, you can take ibuprofen or Tylenol. If you're having body aches, you take a pain medication. You continue to drink fluid. And then if you're sick enough to require hospitalization, similar supportive measures are taken in hospital along with probably oxygen supplementation. But outside of those things which are not specific to COVID, there are no targeted therapies for COVID for patients who are not admitted.
Oh, great. Thank you so much. Thank you for clarifying that. And of course, speaking with your doctor or pharmacist is always the best way to go as well. So you'll know which treatments are safest for you. So moving on to our next theme. So with flu season and Halloween upon us, we wanted to ask you, how can the flu vaccine help when it comes to COVID-19?
So it's unlikely that the flu vaccine will have a direct effect on your likelihood or risk of acquiring COVID or the severity of your illness if you acquire COVID. But it has an indirect help in the sense that COVID, because the second wave is upon us and likely to continue for some time, it increases the strain on hospitals and outpatient settings. So if we can reduce that strain, in other words, we can reduce the likelihood people are admitted to hospital, then that will benefit everyone across the board, even people who don't have flu or COVID. So the flu vaccine helps because it reduces the likelihood that you'll present to hospital or that you'll be admitted to hospital, or even worse, require an ICU admission. So the flu vaccine is recommended for anyone who doesn't have any contraindications across the board, across all ages, because of that benefit, not even related to COVID, but of course the benefit in that prevents flu itself.
Yeah, definitely. Thank you so much. And then I guess, what should we do about Halloween? So we're hearing from Ontario province that they recommend against trick-or-treating, but we've also heard from other experts that it can be done safely. So a question for you is, can kids safely trick-or-treat this year?
So personally, and the opinion of many other people in the field of infection control, agree that trick-or-treating can be done safely and in low-risk settings. In other words, proper masking, proper distancing, primarily doing it outside, washing hands, all of those things that we've been talking about for several months. But it's important that we follow the recommendations of the public health from the province. In other words, for Ontario, they've recommended that it not be done in certain areas, Toronto, Peel, and Ottawa region, who have the highest rates of COVID right now. And we should follow that recommendation, regardless if it can be or cannot be done safely. But for the areas of Ontario outside of those hotspots, then following, and the province also released some guidelines for people in those areas to do it safely. And it follows those principles that we've been talking about for many months, making sure that it's done safely. So if you're outside of those regions, you can go forward as long as you follow those guidelines.
Perfect. Thank you so much for emphasizing that. So check with your public health authorities' recommendations. And lastly, so our last theme for you today is about staying up to date about COVID-19. So we've heard a lot of information from you and about COVID. So how can we all stay up to date about that? So our first question is, how can someone better understand the daily media reports and what data should they focus on?
Yeah, there's, as Mohit described earlier, that there is so much information out there. There's so much focus on the media, and rightfully so. I mean, it's an important topic to cover, but it gets to the point where people are overwhelmed with the amount of information out there. And I think focusing on daily counts of COVID may not be as helpful. It may not tell you the whole story because it's likely to fluctuate from day to day from various reasons. The important thing to focus on, if you want to look at the numbers, and again, you don't really need to, you don't have to, but if you're interested in covering or following the story, the number that might be a little bit more helpful is to look at 7-day averages. So that kind of smooths over that daily fluctuation that we see. And then you don't necessarily even have to look at that number every day or even every week for that matter. I think the data that people should be focusing on and the news items that people should be focusing on is the recommendations from your the federal, provincial, and then municipal public health units, they will be on top of the numbers, and they will also be on top of recommendations. So that's the most important aspect to follow from in terms of what comes out of the media, is those recommendations from those official bodies.
Mm-hmm. Thank you so much. And I guess because it's so important to stay up to date, this information can change over time. So I guess a question we have, and if you could speak to this, is why is that medical advice changing constantly over time?
Yeah, I think that there's two aspects to this. One is that we're learning more about the infection, so there could be changes in our understanding, then that changes the advice. The second is that it's important to sometimes see these recommendations from public health not as changes or fluctuations, but more as a release, kind of like a gas pedal, pressing the gas pedal and releasing it. So if last month they said it's okay to do such and such activity, but this month it's not because they're not confident or not knowledgeable or not experts in the area. It's because they are following the closest data to try to make recommendations that are applicable to your area. So they are trying to make it as scientific as possible based on what's known at that very moment. So we should expect, all Canadians should expect that this is how it's going to be for many, many more months, that there's going to be several months where the volumes of disease is low and we can do certain activities. And then there's going to be periods where that's not going to be recommended. And we have to be able to adhere to those recommendations. So we're going to have to do a little bit more restriction what we do. So a good example of that is the masking. Initially, masking was not recommended, but then it was. And that's based not only on the developing science of the time, but also on the fact that the number of cases rose, and hence it became more valuable to mask and to do that more broadly.
Mm-hmm. For sure. And thank you for emphasizing that point that we're still learning about this virus. So there's definitely going to be more research coming through, and we'll have to adapt to that. So thank you. Thank you so much, Dr. Vaisman, for sharing your expertise with us. And this is a nice segue to Lisa's part, who will tell us why reliable information is so important and provide us with some strategies on how we can find good quality health information.
Hello. So since the beginning of the COVID-19 pandemic and was declared, there's been a worldwide effort to understand the disease. Thousands of studies have been launched, many papers published. There's over 100 vaccine trials going on right now. Each of these are contributing evidence-based information to give us a better understanding of the virus and how we can reduce our chances of getting it and spreading it. However, there's also been a rise in health misinformation since the beginning of the pandemic. People have created websites that post false stories about COVID with the aim of getting as many clicks and shares as possible, as mentioned by Mohit. Sometimes they do this to increase their ad revenue, as the more people who visit regularly, the more money they can charge. Sometimes they want to show how far they can spread misinformation, and sometimes people spread misinformation without even knowing it. Social media sites like Facebook or Twitter allow us to create an online community of people who have similar worldviews. This can support us and give us a sense of community online, but it can also be used against us. By creating misinformation based on what people in the group already believe, they increase the chances that the reader will repost or share an article. People are more likely to accept misinformation when it offers a solution that allows them to continue what they're already doing. A recent study conducted by researchers at McGill University found that people who get their news from social media have more incorrect ideas about COVID and are less likely to follow social distancing measures as compared to people who get their information from traditional news sources. A Pew Research survey from 2019 found that 68% of Americans have lost confidence in government institutions due to made-up news and information. An example of this type of misinformation is the rumor that was going around that you could take certain vitamins to help cure COVID-19. If you accept that as true, you may not practice the recommended public health measures, such as wearing a mask in public, washing your hands frequently, and maintaining a social distance, which would in fact increase your risk of getting the virus and spreading it through the community. This is why having good quality health information is so important. The benefits. Good quality health information can help you make informed decisions about your health. They can reduce your anxiety about a medical test. They can help you understand your medications, learn what foods help your health, how exercise contributes to your ongoing health, and give you tools to support your mental health. During COVID-19, reliable health information can help you know when to self-isolate and when to quarantine, know how to prevent COVID-19 and what to do if you have symptoms, understand who's at greater risk, learn how to take care of family members safely, and know when it is safe to engage with the wider community. So how do we tell the difference between reliable information and misinformation? First, is the information from a reputable organization? Some people will use unknown websites or alternate news channels who do not fact check to spread misinformation or create misinformation deliberately. Hospitals, universities, governments, public health authorities, national health organizations, and traditional news outlets are better sources of health information. Is the information up to date? Good sources will date their articles, update them as new evidence is discovered, and provide the date of the latest update. Misinformation is sometimes posted without a date, or the same article will appear again and again without any update. Is it fact or an opinion? Good sources are based on science, evidence, and clinical trials. Articles which contain only the opinion of the writer are not a good source of information, like, I ate this fruit for 10 days and lost 20 pounds. Who is the author? We look for articles that are written by or reviewed by health professionals. You can find this information by looking at the author byline or author biography. Are there medical professionals on the board of directors? This can usually be found in the About Us section of the website. For example, the Canadian Cancer Society uses external experts to review content before publishing, and kidshealth.org, the content is reviewed by physicians and other health experts. Is it information or is it a product? Health information sites should only be providing you with health information. Sites that are selling a product are less likely to provide unbiased information. An example, a site that claims to give health information about vitamins for heart health, but really it's a list of selling features for a particular vitamin brand. Talking to your doctor. Good sites will include a disclaimer that patients should not act upon the information found on the website without consulting a healthcare practitioner. Misinformation sites attempt to convince the reader that there is a conspiracy to prevent them from finding a simple solution outside the medical system. Often this message is written to increase anxiety and a sense of urgency with phrases like, the secret that your doctor won't tell you, or you need to stop doing this immediately. Privacy. Quality health sites will have a privacy policy. It's often found at the bottom of the website. This policy will outline what information they collect, who they share it with, and what parts you can opt out of. Some less reputable sites will ask you for information they do not need for their own benefit. If you're looking for health information, you should not need to give them your home address, your phone number, your social insurance number, or your credit card number. For example, I was once looking for health information on children in grief. I found a really promising PDF on a website. When I tried to download it to review it, it asked for my complete home address and contact information. This made me review the site more closely, and I realized it had been created by a law firm who were looking for new clients. I do not recommend that site. Finally, advertising policy. Quality health information sites will either not have ads or will have an advertising policy which makes it clear what is health content and what is an ad. Diabetes Canada does not have any ads on its webpage, and the Mayo Clinic puts a gray box with the word advertisement over any ad content on the page and does not allow ads for health or wellness products. Less reliable sites will have ads that seem like they're part of the health article. An example of this would be an article that discusses ways to reduce skin inflammation, that mentions goat milk soap, and then has ads for goat milk cleansers all around the content. Some recommended sources for COVID-19 from UHN. The COVID-19 UHN COVID-19. One moment.
Can you see the slides, Lisa?
Yes.
Okay.
There we go. Wasn't the slide I was expecting. Sorry about that. Since March, UHN has created over 30 brochures to help you and your family to help on your health journey through the pandemic. You'll find information here on testing, cancer and COVID, recovery, essential care partners, and virtual care. The pamphlets are created by UHN patient education and medical professionals. On each, you will find the date it was updated or reviewed, ensuring the information you receive is up to date. COVID-19 resources for patients and family. This guide, created by the library staff, provides trustworthy information about COVID-19 for patients. The guide has sections for mental health, hospital safety, family and caregiving, and information on how COVID can affect people with different health conditions. It is an ongoing project, which we will update as new information becomes available. Sections we have worked on recently include COVID and flu, rapid testing, and winter holiday planning during the pandemic, which includes articles about alternate Halloween celebrations. Other recommended sources. Your local public health department. If you live in the city of Toronto, this is the website here, toronto.ca/home/COVID-19. You can find the latest information on important topics like mental health resources in Toronto, COVID-19 orders and bylaws, and reopening information for the public. The Government of Ontario's COVID-19 webpage will give you the information you need to do a COVID self-assessment, find a current testing location, and see your test results online. You can also find the current number of cases in Ontario, and there's a section which summarizes updates from government and public health about COVID-19. The CDC is another good source of information about COVID-19. Their page on people at increased risk covers medical conditions that increase a patient's risk for severe illness and factors that may make an individual more vulnerable to COVID, like people experiencing homelessness, people living in long-term care, and people with disabilities. The information on this site is updated as more evidence accumulates. And the World Health Organization. On their advice to the public page, you can find the Mythbusters, which contains a list of the most widely circulated myths about COVID-19, with evidence-based answers, which include downloadable graphics that you can post to social media. If you're still looking for information, contact us at the Patient and Family Library. We can help you answer health questions, because sometimes there's a very specific question and you do not want to read through an entire website or book on a condition. In this case, we'll try and find you a short pamphlet or article. For example, what is an essential care partner? We have a UHN education benefit pamphlet on that topic. Can you find information on caring for someone with COVID in Punjabi? Yes, the Public Health Agency of Canada has this available in 30 languages. Finding a list of resources on a topic. When you do not have time for a search and need some help finding the information you need, we are happy to help you. There are topics and conditions where reliable consumer health information can be hard to find. This happens sometimes with rare diseases and less common tests. We are happy to help you with this. We do enjoy the challenge. Our information searches can include articles, websites, infographics, ebooks, or videos. Creating a guide to a health topic. An example of this is the COVID-19 guide that I just spoke about. It was sent to you as part of your registration confirmation. Please let us know if there's a topic you think we should add. Finally, we can help you evaluate health information by working with you one-on-one if you're concerned about the reliability of a source. If you have any questions and would like further information, please contact the Patient Family Learning Centers at 416-603-6277 or tgpen@uhn.ca. Thank you.
Thank you so much, Lisa. Those tips were very helpful, and it was great to go through those resources together too. So thank you so much. On behalf of our participants and the Patient Education Program, thank you, Mohit, Dr. Baseman, and Lisa for sharing your expertise and experience around combating misinformation during COVID-19. I'm certain that the tips and strategies you have shared with us today have helped us understand why reliable health information is so important, clarified some facts about COVID-19, and how we can find reliable and quality health information, especially on the internet. So we will now check out our Slido to see what questions have been submitted. Oh boy, there are quite a few. You can still submit questions if you haven't already. To submit them, just go to slido.com and enter UHN Health Talk in the event code. And you can also scan the code using your smartphone's camera or QR code reader app, and it will take you to the page. Just a few quick reminders. You can choose to include your name or stay anonymous, but please note that others will be able to see your name if you do include it. Please do not include any personal details about your health or condition in your question. Our health talks are for general information only, and the speakers are not here to diagnose or provide treatment recommendations. And we'll try our best to answer as many questions as we can until about 1:57 p.m. And you can also vote for your favorite questions by clicking the thumbs up button, and this will bring the questions closer to the top and they'll more likely be answered. So starting from the top here, I'm going to highlight our first question. This person has asked, there's much confusion about exemption from wearing the face mask. Is there a clear instruction somewhere who can actually be excused? So this sounds like a question for Dr. Baseman.
Specifically to UHN, there are indications where somebody may not be able to wear a mask. Some individuals who have severe respiratory disease, like those with asthma or COPD, may not be able to wear a mask, especially if they're using supplemental oxygen. In those cases, if that is brought to the attention of the clinical team that's looking after the patient, as an outpatient, for example, in the clinic, then that team will make a exemption for that individual, and instead they'll wear a face shield. So a face shield can provide some protection against a transmission of the virus when a person cannot wear a mask. So those instructions, if an individual is concerned at UHN that they may not be able to wear a mask, it's best to contact their medical team directly. As for the general public outside of UHN, this may be more ambiguous about where these might apply and what the actual criteria might be. So you might want to contact your local public health authority to talk to them about that if you think you need an exemption based on a medical condition that you have.
Thank you so much, Juan. So talk to your doctor for sure. Okay, so our next question here says, I have heard that COVID-19 has mutated a few times. Is this true? Does this mean that the vaccination trials become invalid once the virus mutates? So this again sounds like a question for Dr. Baseman.
It's unclear whether the fact that the virus mutates will affect any vaccine trials. It's not surprising that viruses mutate. This happens to virtually every virus, and using those mutations, we're able to track how it moves through the population by sequencing its DNA or RNA. So in the case of COVID-19, so far there isn't reason to believe that a vaccine would be specific to a strain, but it's a little bit too early to tell.
Thank you so much. I'm gonna archive that one. So our next question here. So this one says, I find complementary, so examples are dentistry, acupuncture, massage, chiropractic clinics are screening people at the last minute instead of emailing forms or mailing them or doing the screen on the phone, which is inconvenient. This process is prone to error. Should these forms be standardized? So it sounds like this person is asking, and I think Dr. Baseman, this may be another question for you, about whether screening forms should be standardized even in complementary clinics.
Yeah, I think that makes sense. Any of these types of clinics at UHN do have standardized screening, and we, infection control, we update those screening forms as evidence changes or as something changes in the epidemiology of the disease. For outside of UHN, what's generally done is people use screening forms provided by public health. So for example, in Toronto, if one of these clinics are in Toronto, then Toronto Public Health will provide screening forms. Some clinics may alter their questions based on what they're doing, based on the types of procedures they might be doing for patients. But I think generally speaking, standardization makes sense. The process of how to contact a patient may differ from clinic to clinic based on their available manpower. So you might have some where they're able to call ahead, like we do at UHN, generally speaking, or some where it can only be done at the door. So generally speaking, it is better that's done ahead of time so that patients don't arrive at a clinic with symptoms. But that depends on each clinics and their availability, their staffing availability to do that.
For sure. So everybody has different resources and their different contexts, but that's a really helpful resource that you mentioned about checking out the public health websites for examples and templates. Thank you. So our next question here asks, what is the recommendation for mask wearing walking down the street or through a park? What is the likelihood of transmission if you're walking past someone on a sidewalk? So I'm going to turn this one over to you again, Dr. Vaisman.
Sure.
Thank you.
Generally speaking, the likelihood of transmission is very low. You don't necessarily need to wear a mask in public spaces, open spaces in the outdoors. The exception would be as if you're in an area where you don't expect to be able to distance from people very well, or that you expect it to be crowded and you'll have a sustained kind of interaction with other individuals. But if you're walking alone in a park, you don't need to wear a mask. If somebody happens to walk by you, it's very unlikely that person will transmit the virus to you. The only exception might be is if they happen to sneeze or cough directly on you, but that's very, very unlikely. And so in any event, people who are symptomatic should be at home isolating regardless of what they have, whether it's COVID or not. But in general, the risk of transmission with a transient interaction, somebody walking right by you in a park, is very low likelihood of transmission.
Thank you so much. And I guess the risk would be higher if someone was a close contact. Would you mind just clarifying what a close contact is?
So it's hard to know. We use a very rough definition of less than 6 feet and 15 minutes or greater of contact. It's not to say that you can't transmit the virus with less contact, but that's just like a rough guide of a cut point that we have used, generally speaking, to decide whether an exposure has occurred or not. So if you're out in public and you're alone, say, you're better off just to avoid people, not walk near them, not interact with people in a close contact. If you want to speak to someone, try to maintain a bit of distance. And then the best place to do that, again, would be in outdoor settings instead of indoor settings.
Thank you so much. So yes, again, the key takeaways here are to keep physical distance and to wear a mask. Thank you. Okay. So our next question is for Mohit. So Mohit, you mentioned that you didn't get proactive information from your doctor despite being in a higher risk group. Has that gotten better through the pandemic, or are you still needing to seek out your own info and advocate for yourself?
Yeah, so I have received information directly from the transplant clinic, but it's and I understood why it took a little bit of time. They wanted to make sure that there was something a little bit more solid, and it was kind of, I guess, my own anxiety at the beginning, thinking that, if I'm at higher risk and I'm more vulnerable, then what information is more direct for me? But they have reached out, they have provided me with a little bit more information, and they even provided a little bit more specific about how to not only use the public information, health information that's available from the public health departments, as Dr. Vaisman and Lisa were both suggesting, but they also suggested, a lot of it is also based on your own comfort, because a lot of people, especially if we're higher risk, our nerves itself will kind of take over command of how we conduct ourselves in these spaces. So one suggestion was always like, if you're not too comfortable, make sure that you're still wearing like a mask. Like even if you're in a public space, Dr. Vaisman was talking about like the low likelihood of transmission in like open spaces like parks or whatnot. And my physician just directly told me like, but if you're not comfortable, it is a bit more recommended to maybe wear your mask because I'm more vulnerable. But they have, and I still seek out my own information because I know I want to be a bit more proactive, and I understand that there's a lot of demand on healthcare professionals who are doing the work, and those are the physicians that I see regularly. They're the ones doing the work. So whatever information is provided by the healthcare professionals and by these reliable sources, that's when I'll look out for them and just kind of make sure, well, what's a little bit more directed for myself.
Thank you so much, Mohit, and I'm glad to hear that they've reached out and have supported you in that way. Thank you. So our next question here, if I don't live near UHN, do all hospitals have a library like yours? For example, I'm closer to St. Joe's Health Center. And so this might be a question for Lisa. I don't know if you're aware of other hospitals that have patient libraries, or if there are other spaces they can check out for support. Oh, Lisa, you're on mute.
There are other hospitals that have patient libraries. I'm unfamiliar if St. Joseph is one of them. Sometimes you can contact the health science library in the hospital to get patient support. It's worth trying. You can also contact one of our libraries if you've got a question that needs to be answered.
Great, thank you, Lisa. So yes, so the UHN patient family libraries are still open to basically anybody. So if you do have a specific question, you can reach out to them and they can provide some support or guide you to the right support. Thanks, Lisa.
I was just going to add to that because obviously this is a time when a lot of us are not leaving our homes. I'm actually a member of the UHN, like the digital library. So like, even though I'm not necessarily at the hospital, the digital library is such an amazing resource, and I've been able to get a lot of great content directly there.
Oh, great. I'm glad to hear. Thank you, Mohit, for jumping in and sharing that. And even the patient and family libraries at UHN has their own online digital catalog that people can sign up for too. Thank you. So here's the next question here. So this person has asked, I missed one talk about a video style game around C19. I love surveys and this sounds fun. Can you provide the link for this palatable delivery mode? It's by the RCM, which used to give the lectures on Sunday afternoons at the medical auditorium of U of T's King's College Circle. So it sounds like this person is asking for a type of game. And I think we may, oh, Lisa, do you want to take this one away?
I found one that's not by RCM. It was created by the University of Waterloo. It's called Core and Trivia with Dr. Pixel. It's by the University of Waterloo Faculty of Science. You can find it at uwaterloo.ca/science/community-outreach/core and trivia-game. That's a long address.
Oh, perfect. Thank you, Lisa. And this is why you're such a great library resource too. You found that very quickly. So if you weren't able to catch that link, just give us an email or send us an email at pfep@uhn.ca and we can send that to you. Or feel free to reach out to the patient libraries at UHN and they can also send you that link. Thanks so much, Lisa. Okay, so we have, so unfortunately right now I realize it's 1:58 p.m. So we will have to wrap up our question and answer period. But if you still have questions for the presenters, email us at pfep@uhn.ca and we'll respond to you within 1 week. So for those who unfortunately, we're really sorry we weren't able to get to your questions today, but send us an email and we'll be happy to answer that. And again, your feedback is important to us. Please go to the link on your screen and complete the survey, or you can use the code using your, or you can scan the code, using your smartphone's camera or QR code reader app, and it will take you to the survey. And finally, to find out about our next talk, subscribe to our MailChimp newsletter and get up-to-date information about events and new resources at UHN. You can fill out the form on your screen to subscribe by going to the link or scanning the code. Thank you so much for attending, and we hope to see you at our next talk.